Hello, subscribers. This is Dr. Christine Leishely Moore, Ph.D. in Behavioral Science. Most of you know me as the host of Blending Families of Hillsborough County, which is aired on Tampa Bay Community Network channels weekly. However, today I'm coming to you with something that is very important in regards to an orthopedic total knee replacement. Today we're going to talk about pre and post behavior. Remember, your behavior matters in every facet of life. But before we get started, I need to do a little disclaimer. Of the host, which is me, of course, this podcast is not coming to you from an orthopedic surgeon, simply coming to you from someone who has experienced orthopedic total knee replacement. Simply sharing some stellar tips on pre and post orthopedic replacement. Hopefully this will assist someone out there who is contemplating, going through, or has had their total knee replacement. Just wanted to make sure that was clear. Okay, let's go ahead and get started. We're talking about your behavior. Your behavior equals your recovery. Pre-preparation appointments, pre-medical equipment, pre-surgery shopping for self-care, post-surgery day, post-self-home care, and your recovery exit all are equally important. Pre-preparation and pre-appointments. Your behavior, remember your behavior equals your recovery experience. During your pre-preparation phase, this is what is going to happen. Your pre-surgery final orthopedic surgeon team, they are going to meet with you. They're going to instruct you to go get your labs, your medical report from your physician. Basically, all of this is called a clearance. You'll need a clearance from your primary care physicians before you enter the surgery room for your total knee replacement. So, your pre-surgery final orthopedic surgeon team orders, your assurance instructions, your badge and post medications. You will be obtaining post-surgery aids, and we will talk about that later on in this segment. Your pre-surgery body cleansers, your VinPro leg pumps, which is very important, your polar ice cube water bottle, your thermometer, your walker, your cane, your raised toilet chair, and scheduled home health care and in-home physical therapy all are going to be very important. But before we go any further, let's go ahead and talk about your pre-surgery body cleanser, because this is going to be very important before your surgery, 2 days and the day of. Your body cleanser is something that they will give you at one of your pre-op appointments. This cleanser is to be used per the instructions thoroughly. So make sure you use that. Now, there's some other items, products that you're going to need to have on hand. And I totally recommend that you take these items and put them in close proximity of wherever you're going to be stationed after your total knee replacement. Some of these items are Clorox wipes, Vaseline, pads, wipes, cleansing wipes, soap, white towels, and I do say white towels because germs can travel. You do not want any type of germs coming from the cloths that you're going to use on your entire body during this process. So those are just some of the things that you want to make sure that you have close by you. Now, one thing you should do is to take and get a small table. You know those little tables that they use with arts and crafts? Just take and get one of those and put it by your bedside. And put all of these items on that table so you'll have it right by you. Now, one of the main things out of the items, the products that you're going to need, is your thermometer. Your thermometer is one of the most important things. Please follow your doctor's instructions. Your thermometer is your first defense against infection. Infection is your enemy. You want to know of its presence as soon as possible. Allow nothing and no one other than your treating surgeon to touch your recovering total knee replacement area. No one, not even you, without clean hands, gloves, and clothing. Now, one of the main things that your doctor should give you before you actually have your surgery is something called the VenaPro. The VenaPro is a leg pump. It goes on the bottom of your leg and it helps to prevent blood clotting after surgery. So if your doctor does not offer this to you, ask for it. Okay? Ask for it. The VenPro leg pumps, if you are sitting still, if you're being still, use it. Use it. Use it. Can't say it enough, can't reiterate it enough. Use it, especially within the first week to 2 weeks after your total knee replacement. Next is your ice. You need to ice. Ice every chance you get after your total knee replacement. The ice will reduce the swelling and it'll make you feel better. But the Breg, B-R-E-G, Polar Care Cube ice machine is perfect to have close by you right after your total knee replacement. Now, if you're not able to get your hands on the Breg Polar ice machine, some simple water bottles, frozen, wrapped in a towel, whatever you can get. Your ice machine from your freezer or refrigerator, put it in a plastic bag and wrap that knee constantly. And remember, if you are sitting still, ice. If you are in the bed, ice. If you ice 15 minutes on, you want to ice 15 minutes off. If you ice 20 minutes on, you want to ice 20 minutes off. You don't want to freeze the area around there. You just want to keep the swelling down. But the most important thing is to remember, if you are sitting, ice. If you are in the bed, ice. 15 minutes on, 15 minutes off, and so forth. Now let's talk about some other items that you're going to need, and you should have these on hand prior. We're talking about prior to your total knee replacement. One of the most important things you should have is your toilet high seating chair. Use it. You want to use it because your doctor is going to instruct you not to go in that bending sitting position on a regular basis right away. You will be able to sit, but when you're using the restroom, use that toilet high seating to help your knee stay a little straighter when you're sitting. Because remember, that new knee is still adjusting to its home. So you want to give it time to nestle on in there and just cuddle on in and be safe. Okay? So use it. Initially, you do not want to bend. Remember, don't bend fully in the low toilet position. Now your walker. Your walker is very important. You will be giving a walker and a cane pre-total knee replacement. Why? I'm glad you asked. Because your walker is going to keep the total body weight, your total body weight off of that joint area. And you want to do that because, once again, just like sitting with the toilet seat, you want to give that knee time to nestle in there and just fit the way your surgeon put it there without any extra pressure. So even if you do not feel like you need it, use it. Use it. I cannot iterate that enough. Use it. Remember, your behavior equals your recovery. You must give your new knee time to settle in without full body weight. Okay? So the walker and the cane are two very important walking aids that you will have in place pre your post-surgery. Please don't come home without it. You're definitely going to need it. I have had some people tell me that they have come home without it and they're still limping. Yeah. Well, we won't go there, but they are still limping. So just remember, preparation is the key to a successful recovery. Your behavior equals your recovery. Your small bedside table is very important because you can put your ice machine, you can put your leg pumps, and any other items you may need immediately right after surgery right by you, so you do not have to worry about trying to travel to get the things that you need. And one other thing, pre-total knee replacement, you need to make sure that all rugs, small carpeting are removed from the area in which you will be walking because they are tripping hazards. So make sure that you follow your doctor's orders. I'm sure they will inform you to remove those items from your area in which you will be staying. Next are your bands. You're going to be doing exercise before and after your total knee replacement surgery, and the doctor will give you those bands. Make sure that you use them even when you're not participating in your home health care, which you will have about a day or two after your total knee replacement. So make sure that you use those stretching bands to help bend your knee backwards so that you can regain your full motion of your entire leg. Okay, now back to body cleaning aids. You have your wipes, you have your leg wipes, but remember, you're not showering yet. You will not be taking a shower for at least 2 weeks, maybe 3, depending on what your doctor instructs you to do. So you're going to have to use cleaning wipes to wipe around your area and to clean the other parts of your body. So make sure you have plenty of wipes on hand. One of my favorite soaps to use during a pre and post surgery was Ivory soap. I chose Ivory soap because it did not have all the other added chemicals to it, and it was just pure soap. So that was one of the best soaps that I found during my pre and post surgery experience. Let's talk about Lysol spray. You want to keep your living area clean. Infection is your enemy after a total knee replacement. So make sure that you are cleaning, bleaching, and bleaching constantly to keep your living space clean. Let's move on now, but you remember, if you are sitting, ice. If you're in the bed, ice. 15 minutes on and 15 minutes off. In our next segment, I'm going to share with you some videos. Now, please know that these videos are not for the faint at heart. All of the videos will be actual photos of a post-operation right and left orthopedic total knee replacement recovery. And please know that any duplications of any photos within the presentation without written permission is prohibited by law. So, your behavior equals your recovery. Before, the day of, wake up early. Take any approved medications that were approved by your doctor. Complete your full shower routine. Put on fresh, clean clothing and leave early and relax. Task 2, follow your doctor's orders and review this podcast over and over again. Number 3, move, move, move. Moving is like oiling your brand new knee. Following doctor's orders is very important. Your routines throughout your day will depend on how your total knee sets in to its new home. And don't forget, watch this podcast over and over again. I will be your personal total knee replacement coach. Okay? Now, we didn't talk too much about your temperature, but just to reiterate that, take your temperature. Take your temperature every time you take medication or eat a meal. Your temperature will tell you that something's going on. So you want to be on top of that. Take your temperature and do not hesitate to call your treating physician if you have any concerns about your temperature. So like I said, in the next segment, I'm going to show you some actual photos of how the total knee replacement recovers. So don't click on that next button if you can't stand to look at some stuff. Okay? Thank you once again for joining me on this segment of orthopedic total knee replacement. And just remember that your behavior equals your recovery. And if you don't remember anything else in this podcast, ice and take your temperature and move. Okay? Ice, temperature, and move. Thank you for joining me. You all have a great rest of your day, and I will see you in the next segment.